Hi everyone, I'm Dr. Zodkoy, author of the best-selling book Misdiagnosed the Adrenal Fatigue Link. I'm also the director of Soldier On's Resiliency program. And I wanted to take a few minutes and explain what the Resiliency program is and the great results we've been getting. The Resiliency program is a two-part program. Basically, what we start with our veterans and soldiers is we do a lab testing measuring neurotransmitters. Neurotransmitters are how the body communicates with itself, and nutrition, and then we provide nutritional supplementation, and then we also do neuroemotional technique, which is a way to release trapped emotions using the acupuncture meridian system. These two techniques together have been showing excellent results. What I've found is that when soldiers or veterans or even the general public is under a huge amount of stress and it continues on and on and on for a long period of time, the body's ability to keep up with it at some point fails. And when these two lines cross, when the stress becomes higher than the body's ability to meet that stress, you get into this danger zone where people start to get both physical and emotional symptoms such as anger, anxiety, depression, PTSD, and burnout. Recent studies have shown that continued physical exhaustion will lead to adrenal fatigue. This was actually a study done on Navy officers. And what will happen is that when there's trauma, what happens is the body produces a lot of cortisol for the fight or flight mechanism, and what the research has been found is that this high level of cortisol traps the bad memories or the trauma in the brain. Normally the high trauma or stress level would be released by DHEA, but what's happening in our veterans and our soldiers is that since they're under such chronic stress, the DHEA never takes over, and basically these horrible events and stresses are trapped in the brain. While a lot of people realize that PTSD, anxiety, and depression is an emotional disorder coming from the brain, what they don't understand is that it also involves the adrenal glands. The adrenal glands are two little glands that sit on top of the kidneys, and they're really responsible for the fight or flight mechanism. And what happens is that when there's desensitization, where the brain just becomes so used to trauma and stress that it stops sending signals to the adrenal glands, people start to have an inability to deal with just the simplest stresses. And what happens is when you can't deal with the simple stresses of life, you tend to either become very depressed or very manic, or fly off the handle and become angry. I was asked to look into this several years ago, and last year we published a study on the work we did using the Resiliency program. And this is the results we had. This is a test score used the Maslach Burnout Inventory, which is the gold standard for measuring how people feel about burnout, anxiety, depression, PTSD. And everybody in our program either started at medium burnout to severe burnout. And after 90 days, we had about a 40% improvement in their physical and emotional symptoms. And after 180 days, they had about an 80% overall improvement. So this is really showing some great progress. The thing I like about this study was that everybody improved at least 40%. This is one of our stars. He started out being stressed, depressed, apathetic, fatigued, insomnia. His Maslach burnout score was a -2, and in the course of 90 days, his Maslach burnout went to a 21. 18 is spectacular. So he actually improved 115%, and he was left with only some insomnia and stress. So there's a lot of hope for our veterans and our soldiers. This is an active duty Marine. I think he has 25 years in. This is one of his lab works. You can see he's out of range and all jaggedy here, and by the time we were done, he has a nice, smooth, normal curvature to his hormone levels. This is his neurotransmitter, how his brain functions work, and you can see he's very low on the top, but after we did some work, he's all nice and balanced out. So basically what we found after 90 days of the resiliency study was there was about a 40% decrease in their Maslach inventory score, about a 40% decrease in their physical and emotional complaints. No side effects. 25% of the subjects actually became minimal or no burnout. And this was all done basically using lab testing and nutritional supplementation, and no real lifestyle changes. So this is a very promising technique for dealing with the problem of PTSD, anxiety, depression, burnout, and anger. The second aspect to the resiliency program is called neural emotional technique. Neural emotional technique is based on the Chinese acupuncture meridians, but instead of using needles, we tap some points. It's not talk therapy. It's basically designed to allow somebody who's had trauma to visualize their trauma or say what their trauma is, and then use acupuncture meridian points and tapping to relieve that emotional stress, balance out their emotional energy. The thing that soldiers and veterans seem to like is that it's fast, it's effective, they don't have to talk it out, and this is done by licensed healthcare professionals only. So these two things together have been extremely effective. The reason that this all works so well and the results have been phenomenal is because we're balancing the body. It's nutritionally based. The methods we're using are non-addictive. They're getting to the root of the cause and not just treating the symptoms, and that each one of these protocols is personalized to each one of the subjects. So this is just a short introduction to what the resiliency program is for Soldier On, and I hope you are willing to get involved.